My name is Edward Adkins, and I've been a family practice physician. Always wanted to be a doctor because my father was a general practitioner. The old-fashioned kind that made house calls and delivered babies and did surgeries and you name it, that's what he did. So I kind of followed in that footstep. Always enjoyed doing that and still do. So I'm an avid traveler and love to travel. The church we were going to had done some mission trips prior to when we started there. I had the opportunity to join that team and have been part of it ever since. Our church has been a strong supporter of the missionaries, and we go over there to provide a need for them and for the people that they're ministering to. Probably some of the worst places that we've been, at least when we talk about economics and third world country, was Haiti after they had that big earthquake a few years ago. There was just a lot of devastation there, a lot of people injured, a lot of amputees, tragic kind of stories. One story that stands out though was that where we were staying at a mission orphanage in Haiti, they had been in the process of trying to build a hospital, but at the time we were there, it was still just a Quonset hut with open ends on each end. But there was a lady there who had lost 3 of her children and her husband, still had a couple of children left, but had also been hurt badly when her leg had crushed, and was there trying to recover and heal. But I'd been told she really was going to have to lose the leg. For her, that meant she couldn't work, and if that meant she couldn't work, she couldn't feed her kids, so she refused. So the church was able to work out a visa to get to the U.S. so she could have her leg fixed. The thing that is so memorable about it was her attitude, that she continued to praise God even in the midst of all of this. She was able to bless us in return. Other times, El Salvador, in fact, probably our first time, the need, we would set up in a church for one of our medical clinics, and the lines would just be blocks and blocks and blocks before we ever even got there. And how the people just so appreciated what we were there to do for them, and how their spirits and their attitudes, even though we would call them very poor, really had a rich spirit. So it's really eye-opening to see. We've been places where we've been invited to their homes to eat. It's been a very eye-opening experience for me. You know, I've always gotten much more out of it. It's so rewarding to be able to do that. You know, it's not like I feel like I'm giving anything, really. I'm receiving. When we've gone down, we've, been able to give medications. We've been able to provide services. Sometimes we've had some critical kind of patients. Most are just people that are sick, headaches, emotional needs. So it's just been a very, very rewarding thing in my life. We've been in our travels a lot to Central America, Nicaragua, Honduras, El Salvador, some in South America. Well, the lack of hygiene and clean water is always important. One of the things we always had with us were medications for worms and parasites. We knew that they would be reinfected if we could give them a month's worth of medicine in a young developing child. It could make a huge difference in their life just because they can get nutrition for at least a while. One thing I did notice, that as time progressed, there was improvements in some of that. Governments begin to have some clinics where, although not readily available because of the distance that people had to travel, and sometimes other mission teams would be down in the same areas and be able to provide service too. And we also have counselors who pray with the people who come in, and everyone that comes in gets a chance to receive salvation.